Hi, everybody. Are we ready to start?
Yeah, good afternoon.
Good afternoon, everybody.
Good afternoon.
Good afternoon.
There's some people I can see Lucamber. I can see Mr. Francois. Okay. Lucamber video is on now. Ms. Gemma video is still off. And Mr. Francois also, his video is still off.
The video is
I
on.
think that if, I just want to make sure everybody can hear me.
It's fine, 100%.
I hear you very, very well.
Yes, from my side also. Very well.
Okay. Mr. Esteban, can you hear me?
Yeah. I understand all very well.
Okay, perfect. So once again, good afternoon, ladies and gentlemen. I want to welcome you to this session of the African HR Forum webinar with the Minister of Civil Service. Today's topic, we are going to be discussing the effects of the COVID-19 on public administration, beginning of a new era. With me today, I have a very high panel composed with Mr. Esteban Nzogo. Esteban Nzogo is the HR Director at the Ministry of Civil Service of Equatorial Guinea. Mr. Esteban, you are welcome.
Okay. Thank you.
And then also with us today, we have Dr. Madi Ye is the acting resident coordinator of the UNFPA resident representative of Equatorial Guinea. You are welcome, Mr. Madi.
Thank you.
We also have Mr. Francois Mouringira, is the director of the International Labour Office, Decent Work Technical Support Team for Central African and Country Office for Cameroon, Sao Tome, and Equatorial Guinea. You are welcome, sir.
Thank you. Good afternoon.
We have Mrs. Gemma Mikwe Obiang Mange, sorry, Deputy Technical Director of the Telecommunication Regulatory Body. You are welcome, ma'am. We also have Honorable Professor Lukamba Muhia Chobe, Associate Professor in Public Management and Administration, the School of Government Studies, South Africa. You are welcome, sir.
Thank you for inviting me.
So as I already mentioned, today we are going to be discussing on the effects of the COVID-19 on the public administration, beginning of the new era. As we all aware, with these questions were sent to everybody to study and analyze so that today we can have a fruitful deliberation and a good session. The global pandemic, as declared by the World Health Organization, has worked serious havoc worldwide in each of the administrative sectors. COVID-19 has shown the weaknesses and shortcomings in various areas of the public administration, such as health, education, the social and commercial sector. On the other hand, blocking sectors such as the tourism, transport. To all this, it is essential to know what the emergency plans have to be prepared in favor of each of these sectors, and above all, to know what are the strategies have been developed for the post-COVID-19. We have two blocks. The first block is the difficulties caused by the COVID-19 in the public administration, especially in education, tourism, transport, health, social, and commercial sectors. So I'm going to start with the first question. In your opinion, which sector have been the most affected by the COVID-19? I will start with you, Mr. Francois.
Thank you. Good question, very difficult to respond because which sector the most affected by the COVID-19? I think all economic sectors are in a way or another impacted by the COVID-19. If we talk about tourism, hotels, restaurants, so on, it impacts also on agriculture, on other sectors of economy. So I don't think we can now say, okay, one sector, one or two sectors are most affected than others. But when study still continuing to see where the impact is more pronounced than others, but we can see it's clear that commerce, restaurant, hotels, aviations, transport, all these sectors are affected, but we cannot tell now which the most sector is more affected, is more impacted by than. But all sectors are interconnected. In economy, there is no standalone sector. All sectors are interconnected. If the COVID impact on agriculture, for example, it will impact also on commerce, on restaurant, on other things. So I think this is very important also if we want to find solution or to address the challenge caused by the COVID-19, we have to look at global phenomenon, not just as one sector which is being impacted, but as an integrated, which is very impacted by the COVID-19. So I don't think for now we can, for the sake of finding solutions or how to address the challenges, we have to look at the issue as a global issue.
Mr. Francois, give me a second, please. I want to ask all the panelists to please off their microphones so that we can only hear the speaker. And then when you are giving the floor, you can on the microphone. Thank you very much, so that we don't interrupt. Thank you very much. Mr. Francois, you may continue, please.
I think I'm done, but I want to repeat these things. The economy is, right, it's one economy in a country X. Even in a region, sub-region like Central Africa, it's one economy because there is interrelation between all economies, all sectors. I think if one part of the economy is impacted, it have effect on other sectors of the economy. So it's very important to look at at the bigger picture as economy if we want to address the issues of the impact of COVID-19 on the economy. So I don't think we can single out one sector. If you say, okay, you have to address issues or challenges faced by the hotels or restaurant, aviation, transport. But what about agriculture? What about, let's say, other sectors? So I think we have to look at as a one thing. Of course, we have to start from somewhere, but I think it's important to look as a big picture because one sector impact on other. It's like it's obvious. So I think. Can look at it like this. Thank you.
Thank you very much. Thank you very much. Dr. Mahdi. In your opinion, can you tell us, you've been somebody who's connected with the UN system and seeing the impact this COVID-19 has brought to the continent of Africa. This COVID-19 has shown us how weak our institutions were before all this pandemic. What, in your opinion, which way should we go as a continent? And in your opinion, what should we do after the COVID-19, if there is any after?
Okay, let me just, let me start by thanking Africa HR Forum for organizing this important webinar, and also for giving us the opportunity to contribute in the debate. And also allow me to commend the tremendous job the government of Equatorial Guinea is doing through the Ministry of Health and Social Welfare as part of the national response to COVID-19 pandemic. Of course, with the support, as you mentioned, of the United Nations Development System in Equatorial Guinea, be it resident or non-resident agencies, including but not limited to multilateral and bilateral cooperation, civil society organization, because we have seen them intervening, and also the private sector. Having said that, you mentioned it very well. I think this is a global health crisis that is completely unexpected and unprecedented. It is unexpected because no one was better prepared to deal with the crisis. And also here we are talking about public administration, because the first question you mentioned, which sector we think is the most affected. And I think the response of my predecessor is quite eloquent, because it's clear. Even if I can say that, if, for example, we define the public administration, we all know that it's about administrative activity that materialize by the exercise of public authorities. And who think of public authorities, you will think of some institutions or block of or group of institutions, but mainly exercising a function which are non-marketable. I mean, non-market, because it's not to make any benefit of that. Is for public services. And also you may discuss about how, for example, those operations can be carried out and how this can generate, for example, income, wealth at the national level, and how those resources can be redistributed or reinvested in the economy. That's the role the public administration has to do when it's very well functional. And if you take into account that, what is the gain of the public administration? The gain will be the return, for example, in terms of taxes. I mean, any other compulsory contribution, for example, those actors of the socioeconomic life have to do. So if you look at that way, so it's almost cross-cutting impact it will have. It will touch all the sectors, because it's about people and how those people intervene in the economy, and how best they can really take advantage of any conducive environment created by the government to make sure that the businesses are working well. So if you take into account of that, so my response will be close to what my predecessor said in that perspective, because all the key sectors of the country's socioeconomic life are affected. But I would add, but it all starts with the health sector, because we are talking about the COVID-19 pandemic. It all starts there, when he started, for example, let me just go back in March, middle of March, when he started, how prepared were we? No one was prepared. Anywhere in the world, I think every single country, no one was really prepared for this. So what does it mean? So it will depend on the strength of your health system. The more your health system you think it will be strong, for example, in terms of, I used to say, not only in terms of the availability of services, but how those services are delivered, people who deliver those services, their capacity, and also the quality of those services, everything intervened. So I would say, of course, it's all the sectors of the socioeconomic context which are affected. Health first, challenging, and of course, as we are all individuals, we are all in such a condition that the business are not working very well. We mentioned agriculture, of course, everywhere. If people are mobilized, they cannot move how things will work. Agriculture is impacted. Tourism, of course. Every single sector of the public life is affected. Education, of course, we have seen that. In some countries, even they were talking about the school year is completely jeopardized. So that it is. So it's just now to try to respond to the crisis. Of course, if you are in front of many challenges, what do? You prioritize according to your means, because you have to move forward. Everything is urgent. So among those urgent, you have to find priorities there so that they can be addressed. And of course, not only you, but also as a government, but also with all the stakeholders, all your partners, be it at the bilateral level, multilateral level, like us, United Nations, but also civil society, and of course all the development partner who can be mobilized to fight the disease. And also one thing which is more important, and I think I can credit what, for example, the philosophy of Equatorial Guinea, because when the crisis started, it all started where? In China, we were saying. It all started in China. If China have controlled the crisis there, and so that it can not, we didn't reach, for example, the countries like other part of the world, it will be better. In that philosophy, I think even the country in Equatorial have done something else.
But Mr. Madi, excuse me, allow me to ask you a supplementary question. We knew that this virus started in China, and then it got to Africa 3 months after it started in China. And still, most of our government and countries were not fully prepared to combat this pandemic, to combat this virus. Why? Because of a lot of ignorance, because most of the people were like, oh, this is a white man stuff. This is not gonna affect us in Africa. How important is the information to the people in this kind of situation?
Yes, if I heard very well your question, I will just correct something there. It's not ignorance, no. You are talking about the coronavirus. You are talking about the COVID-19 pandemic as we know how it is now. It's a lack of knowledge globally, because no one knows about these things. That's we have to make the difference. Of course, at the individual level, okay, this is not our, so that's another thing. But I'm talking about public action, because that's what we are talking about here, public action. Public action, you take things seriously, but the more you will know about the disease, the better or the stronger will be the response you will give. But we will all completely learning by doing, by responding to the disease, whatever the type of country, in developed countries as well as in developing countries. So to be completely brief in the issue. So what I'm saying that is just because your question was how we, second part of your question, how we see, for example, the after the crisis. Because for now, even, who is talking about after the crisis? Because we don't know where we are going. We have to live, knowing that these things is present. So we have to continue business, taking into account of it. Even I cannot project even myself saying that maybe by the end of the year it will finish. No, we cannot, because lack of, global understanding and global knowledge, control of the disease. So it means that we have to, according to what we are learning, according to the way we are even now doing business, the way we are behaving, for example, we have to capitalize on that and continue to do better so that we secure the bright future. Thank you.
Thank you very much. Thank you very much, Mr. Madi. I would like to engage the only lady we have in the house today. Ms. Hema, in your opinion, which sectors have been most affected by the COVID-19, and what is the way forward?
Okay, hello everybody, and I have to excuse myself first because of the technical difficulties that we had, so I came a little bit late when you guys have started already. So, well, going for the question, for my opinion, what I think for the administration, this COVID-19 has affected everybody, as Mr. Madi said. Most of the affected area, I think, besides the health, as he mentioned, I think is the transportation here in Equatorial Guinea. Of course, it's true that there are other sectors very important, like tourism, like let's say education. It's true, education also. But for my opinion, I think transportation, I saw that they suffer a lot because we see...
Transportation, you mean the aviation sector?
I'm sorry?
The aviation sector.
Not only the aviation sector, also the transportation here in the city. I'm going to be a little bit more specific. I don't know in the other countries, but here the taxis, the public sector, the way people used to move, there was a lot of difficulties. I know that right now has been, now it's becoming a little bit more relaxed, although we still, how to say it, we still unknown to the sickness, but I think transportation, and the next one I think will be education. Since all we know, all the countries, the education, they had to stop while they were in the middle of the, how to say it, on the middle of the year. So, well, hopefully it's gonna be better. And well, most of the things I think you guys have said, but I'm gonna say, as Mr. Mehdi said, health, transportation, and education. That's it.
Thank you very much. Thank you very much.
Thank you.
I would like to hear from Prof. Prof, having heard our previous speakers, in your opinion, what do we need to do?
Thank you. Thank you for having me, and thank you for inviting me in this platform. What I'd like to say, I'll just give a general perspective, because all the colleagues, what they try to say is almost what I'm going to say now. If we start looking at it in the public administration, the first thing is to be able to implement policy. Now, when we look at it here, during this COVID-19, all the countries try to see, all the country, they've been affected with the issue of COVID-19. When you look at the United Nations, they say 108 affected with COVID-19. Now, what we need to do, what the government, every government should put a plan into place, because when the COVID-19 started, last year when it started it in China and so on, you can observe many countries, especially in Africa, we are not well prepared compared to the Western countries. Now, which sector it's been affected? When we look at it in a public sector, what I can say here is the health sector is the most affected. Because of what? Because they are trying to deliver service on a daily basis. When you look at the case of medical doctor and nurse. Now, when you look at it in the private sector, all the sector is being affected. There is no sector you can say this one is not affected. When you look at it like in the leisure industry, like my colleague who say that you look at it in the tourism, you look at it in the restaurant and on the service and so on. All these sectors have been affected. Why I'm saying this? Because when there is no activity, there is no business, and it becomes very difficult for you to pay your employees. That's why I can say the private sector in general are much more affected by COVID when we compare them with the public sector. The reason I'm saying this because when the private sector does not operate, there is no income to the employee. It has become difficult for the employee to continue paying them. Look, when I can just like give an example here in South Africa, where you see, especially in the tourism industry, they requested them just to operate on level 3, because when we had a lockdown here, the government put it in a 5 level. We started in level 5, in level 4, and then they only start opening in level 3, and they restrict them not to sell beers. And for them, closing like the selling of beer is one of, they're losing a lot of money on daily basis. And this shows that COVID-19 in Africa, especially in developing country, it affects every single sectors. And in some of the countries, there is no money to bail out some of those companies, and many of them are striking, and some of the business are closing. What we need to do, what the government should do in Africa, we need to have a plan, a preparatory plan in place to say, in case of this pandemic, it's coming again, what government must do. In terms that we need to have communications. It's very important across the board. People should know about it. This is not like to say, no, this is not to come to our country. Everyone should be prepared. We need to have a risk plan into place, what government need to do, what the private sector need to do. Those are, when we have all this into place, I think if there is any pandemic next time, most of the government will be able to respond it effectively.
Thank you, Prof. Do you think after this pandemic, Africa needs strong leadership or strong institutions?
There is a need to have a visionary leadership in the government first, because when you have a strong leadership, it will help a lot on the political level and also in the private sector, because you're not going to need only visionary leadership in one side, but in both sectors, in the private sector and in the public sectors. And also government must also budget for this kind of pandemic next time, because most of the government, they didn't budget for this. And then when it comes, and many of them, you know that in terms of like national treasury, some of them are very weak in terms of budgeting, and then many of them start to struggle. And then the best way it was to go to the IMF or the World Bank to try to apply for a loan, to try to assist for, especially in the health sectors.
Thank you very much, Prof. Mr. Steban, you being a director of the Ministry of Civil Service of Equatorial Guinea, what are the mechanisms the government is putting in place? Because we know after all this pandemic, or when we go back to the new normal, there will be a lot of debts from companies, from even the government. Is the government putting something in place to try to balance this equation? Mr. Steban, please, your microphone. Steban, we can hear you.
Yeah.
Yes, thank you.
Okay. We take many efforts to do before the begin the pandemic, but we are not very prepared, very knowledge to use. But we think now we have now many experience, many I can do many. We enjoy together, and we have experience now. We can work with health center, with other society. The government have many strategy to use before, but in the past we have not any experience to use. But now on function public we have experience many. I can tell you many mechanisms to use after the pandemic, this pandemic.
Thank you very much. For what I heard from Mr. Steban, before the government has no experience dealing with this kind of situation, but with this COVID-19, with everything they have learned, they're now fully prepared to take whatever may come after, because with this, the government and the civil service in Equatorial Guinea has taken account so many things into consideration. Thank you very much, Mr. Esteban. I want to move to the next question, and I think we need to be a little bit conscious with time, because we have for just 1 hour 30 minutes, and now we're gonna push it a little bit to 1 hour 45 minutes, so that we can finish on time. So I want to ask this question to Ms. Hema. Telecommuting has been one of the ways adopted by both the public administration and companies to deal with this COVID-19 situation. In fact, do you think this form of work has been effective, Mrs. Hema?
I'm gonna say, well, thank you for the question, because this is my sector, and I'm more, how to say, I'm more relaxed with this question than the others. So, okay, I think, of course, it has been, well, it's difficult, of course, but I think it's very effective. Since we know that in the public administration here in Equatorial Guinea, 2 years ago, 3 years ago, they started, the government tried to push the administration to work online with telecommunication, but it was not...
to digitalize the administration.
Yes, exactly. So they pushed the administration to try to start to know, but it was difficult. We didn't see the improvement. But now with this experience, I know it's a bad experience because it's a sickness that is affecting the pandemic, well, all around the world. But it has been really a good chance for the administration here in the part of telecommunication here in Equatorial Guinea, because now is when we see the administration really pushing the work online, the how to say, the reunion online, co-working. People didn't see that before. They were more into trying to have the meetings face-to-face, working with papers, but now we can see that this is the best way, and they can see it, because now, for example, we are having this reunion here, and we don't have to be all in the same area. We are all in different places, but we can have this discussion, we can come with solutions, we can exchange our opinions of how we can improve everything, but all this because of the telecommunication. So my answer is yes, it has been really effective. Thank you.
Okay, and I'm gonna stay with you because I want to ask you another question. You being the director of the body that regulates telecommunication in Equatorial Guinea, do you think companies are doing enough so that the whole population of Equatorial Guinea can have access to cheap internet? Because without internet, we can go. This new form of life can be stabilized if there is no good internet, accessible and cheap for everybody.
Okay, for this question, it's a little bit difficult, but I have the answer. I have been working for in this sector for, well, actually I work for the Ministry of Telecommunication for more long time. But in this, for the regulator, I have worked just for 2 years. And since I'm here, I'm not gonna say I'm making a change, hopefully yes, but I think it's the work of everybody. We are working really hard to have this means of how they call it. We are working hard here in telecommunication to make it effective for everybody. I can tell you that these 2 years that I have been here, the regulator have come with a project for the government where we're gonna gradually reduce the prices, because since of the economy, we are working as a commission that works with different parts of the administration. So we cannot do the, how they call it, the transition just once. We have to do it gradually because there are many sectors that are involved. But I can tell you, everybody, that we are working really hard and we can see improvements. Since we started doing the reduction, now we see more population engaged in telecommunication. The prices are being reduced gradually, of course. It's not like other countries that have, they have it well done. We are just going step by step to see how it's also affecting the economy. So I think that's what I can say.
Thank you.
Thank you.
Thank you very much. Thank you very much.
Yes.
Mr. Do you think this has been effective? And do you think we need to adopt this new method even after the pandemic?
I'm sorry, the question is for me? I couldn't hear, it was just...
The question is from Mr. Madi.
Ah, okay, thank you.
Sorry, I didn't hear my name.
No, I was asking, do you think this new method has been effective? And do you suggest we should adopt this new method as our new form of life after the COVID-19?
Yeah. Okay, just to quickly, before getting there, because there is something which was said, I'm interested to just put 2 bullet points there, which is related to the question you asked about the, when the first one was discussing. I just want to say that about the crisis, the prevention. I mean, emergency or whatever crisis prevention. It's very difficult because you don't know. Crisis like this one is much more complicated to understand, because I talked to you about the knowledge of the thing and also how to be prepared so that you can tackle, get to the right solutions. So it's very difficult. So what is required here is anticipation. How best we can get prevention involved in the programming of the development in the country. I mean, that means that it responds more or less with the from the question asked by Prof. Mukamba and so forth, because things are not budgeted like this. No one was thinking that these things will arrive. So it's about preparedness. So having said that, this crisis also taught us that history repeats itself. But even though it's repeat, because it's not the first pandemic we are facing. There were pandemics before, 1, 2, 3, or before, with millions of people who died before. But we never learn from those things. We are never fully prepared and ready for such a situation. So what does it mean? It means that, of course, the public action, as I said, the public authorities, what is required there is just, because that's their role, is just to, what they can do is just to create that conducive environment so that everything's work when situation happen. So that's the reality of it. But to know exactly what I have to do, A, B, C, D, is very much complicated. So you have to create, you have to strengthen all the different sectors. How, for example, as I said, the health sector will be strengthened in terms of, so that if a situation arrives, they can face this. But how even the economy can be structured such a way that people respond better and so forth. So these are unexpected and not very well understood crisis. But now, if it's very much understood, we know that these things can come if you don't do that one. We take into account in programming much more easily. Now, to come to your question about telecommuting, of course, if before the COVID, there were people who are doing few things. If you are a manager or you have an entrepreneur, you have a big company, and you are renting, for example, a big building, you are paying fees and so forth. With the technology and all those things, people was anticipating before. So the crisis, what the crisis will do, what we learn from that is acceleration of the processes. It will accelerate it because some companies, there are many companies who function, they don't have office, physical office. They are virtual offices. They exist before the crisis, I'm saying. And at the same time, in the sector of education, you may contemplate, for example, areas which are not even much more relevant for if you project yourself in 30 years old, in 30 years after, for example, if you say in 20 years, do we need to prepare people in the specific area or not? No, there are new areas, for example, you have to explore. So it's all the sectors have to intervene. First, education sector. That revolution has to come in every single sector. And now, telecommuting here in Equatorial Guinea, I would say also it has been effective. It could be even much more effective because from the beginning it was complicated as people are not used to. But when it comes, it simplifies many things. It allows people also to work in the office as well as out of the office. So that it means that this kind of work method of working should be promoted and also improved in any cases. So even officers in peacetime, in normal situation, office can continue to work. Someone who is in Bata doesn't need to come and be in the meeting. If you can connect because you have resource constraint, why not? And so forth. Because the country also is like that. You have islands and you have a mainland. So it can be capitalized. This experience can be capitalized. On the contrary, we have to build on that. We have to strengthen it, reinforce, so that we become more or less independent. People don't need necessary to move if you have to deal with some urgent issues, for example, and there is no plane or there is no flight and so forth. Why? We can think of those needs. So, of course, this is very much welcome. I'll just end by saying that it interpels not only the public administration, but telecommunication, ICT need to be strengthened very much in the country so that it can be affordable for people. Large part of the population can have access to it, and also it could be also of quality, because more we will be advancing, more you will need some capacity that make those like this teleconference much more effective. And yeah, thank you. I can't hear you. Alejandro, unmute your mic, please. I can't hear you.
I would like to hear from Professor Lukamba on this question.
Which question? Telecommuting?
No, I'm going to ask you a different question, actually.
Okay, no problem.
We must emerge stronger from this global crisis. What are the mechanisms to be adopted by the public administration to strengthen these sectors for future similar damage?
That one is in block 2. Am I correct?
I'm still in block 1. The second question in block 1.
Or the second question in block 1.
Yes.
Okay, as I said previously, what mechanism, what need to be put into place, the state must have a preparedness plan into place. This must be in the 3 spheres of government. It should be central government, provincial, and local. And what needs to be done is communication to the public is a key. The more communication you drive out to the community, people will know about the pandemic. Also, what needs to be done, we need to have a capacity building for civil service in terms of how to deal with the COVID-19. Also, government should provide support in terms of protection of equipment, what we call PPE at workplace. And the mechanism is, in terms of like distancing, must be a requirement. Also to have a restriction on traveling during the pandemic. This is the mechanism government must put into place if there is COVID-19. Now, public servants should know how to force it. We can say the police service in terms of like if I give an example here, in terms of transport, the government decided that in terms of like the bus, 70% of the commuter could enter the bus to avoid the transmission of the virus. Also, to be able also to wear your mask. Like currently, you cannot go outside without wearing a mask. It will become like a government mechanism for you. I protect myself and then I protect also my neighbor. Those are some of the kind of a mechanism every government should put into place in terms of, especially in case of COVID-19 pandemic.
Yeah, let me ask you. There is this new regulation or law that the government of Spain just put into place. They call it the COVID card. Now they are going to ask you to have a card like a little ID to show that you are negative of COVID-19, because they went from level 4 to level 1, and they're now back to 200, 1,000 cases per day in recently. So the government now put in place this COVID card that if you don't have this COVID card, you can be arrested. Do you think this is a good mechanism?
When you see the case, what is happening in Spain now, when they went back to level 1, people went back to the normal life instead of like protecting themselves. But what it's been applied in Spain, look at us here in developing country, it will become very difficult for us to have that kind of technology, because currently there is nobody now is being tested, because it will become much better if everyone is being tested, and then we can have that kind of technology. But we need an advanced technology like the case of Spain to have that kind of policy. If we don't have that technology, an advanced technology, it will become very difficult for us to apply that law in Africa.
Yeah, thank you. I want to ask Dr. Madi this question. Dr. Madi.
Yes.
Yes, I want to ask you this question. Following our conversation with Prof right now, I'm aware the government of Equatorial Guinea has started a massive testing campaign. How effective is this campaign?
Yes, effective, I think it will, because it's actually start on the 16, from the 16 June, the massive test you are talking about in the island and as well as in the mainland. Yeah, so yeah, that's important because it's related to the response said by Mamba. If, for example, you have just before in the beginning, you know, the capacity of test was reduced when we started. Have a few people you tested on the daily basis. So that's not enough. Because ideally is, for example, to test the whole population and to separate people. When you test all the population, for example, in a country, that's, I mean, it's ideally I'm talking about. Now to do it is another issue. But if you test everybody, you suppose that you test everybody, you know who are positive, and you put them in one side, the others, you put them the other side. You separate them from which means that you won't have transmission for the others. Then you control the others. When they are, they recovered, then they get out from the group and they go to the own group. Then you deal with things. That's, I'm idealizing the thing. But to do it is more complicated. But what the government of Equatorial Guinea is doing is very good because at least we decide to do the massive test with the provision of all the resources we need to do so, provided by the government. So if you combine that massive test, I mean, today even we are doing the teleconference. Before we started, they were in my compound here. I'm in the United Nations. I'm in one of, but they were there testing people. They did yesterday. Today I didn't know that issue. So, and there are many people here, even I don't have them in my list, who decide to do the test, which is very good. So, but what is extremely important here to mention, to do the test, and for example, you are negative, it does not mean that everything is fine, so you have to behave as you want. It means that you have to be more cautious again to make sure that you comply with all the preventive and protective measures so that it can reach you, the disease won't reach you and won't reach your families. So it become more, not, I won't say more complicated, but you have to pay more attention that you make sure that you maintain that status, because you can be negative right now and you go to party in the evening, you can get it there. You understand? So because we are not in the contest, I'm saying we separate people. If people are mixed, we are not separated, we are together. If you are tested right now, they give you back your result, they say you are negative, yes, fine. It means that be more responsible. Make sure that everybody around you is taken care of, and everybody around you is healthy and safe. That's what he was saying.
What you are trying to say is being negative does not mean you need to go back to your former life. Being negative means you need to be more careful to not contract the virus.
Yes, and protect the, but people around. Yeah, in doing so, you protect, of course, the others in your family, in your community, etc. So that's what it means, because in some countries we have seen that when they relax, for example, the measures and they start partying, and yeah, that's worrying. So that should not be. So this message will be very much clear. I think so.
Thank you very much. I would like to hear from Mr. Francois. Mr. Francois.
Yes.
How do we what are the trends to improve this situation of officials after the COVID-19?
The trends.
The trends, yeah. The trends means the resources put in place to improve the situation of officials after COVID-19, because you know that there are a lot of officials from the health sector, especially, which have been the most vulnerable in this our fight against this COVID-19. What do you think we need to do after?
Thanks for the question. I think the health sector staff, they are on front line. In many cases, they are not protected. Everywhere you have seen positive cases in Europe, in America, in Africa, also they are dying because they are not protected, because the situation, I think we have to do something about it, because if we don't protect them, they cannot protect us. So I think it have to be the first priority number one. How do you protect the staff, the health staff, personnel, in hospital, everywhere, to ensure that they protect us? Very, very key, very important. We have to put resources, we have to put all means we have to protect them so they can protect us. I have a story here in Cameroon, the health staff fled because they couldn't take care of somebody COVID positive, because they fled, they were not protected. They said they had to leave the site in the free because they say I will be infected. So it's important to ensure that the health staff, they are very, 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 very protected. We have to put resources, all resources we have to ensure that they are protected. That's one. Second, I think there are many kind of resources we have. It's not only money, you know. The issue is not money. The money you can find anytime, anywhere. You can find resources in terms of money. But the first resource we need is awareness of everyone, every citizen, every African, every government, every authority, to ensure that we know that the danger is there and we have to fight it together as one. Not saying it's government or employers, workers only, but as a nation, as Africans, how we fight this COVID as one. You know, what I'm saying is that every country is doing what it can do to protect its citizens, what is good. But I don't see any regional, for example, any regional policy, any regional program, any regional discussion. How do we fight the virus together as a region, even within a country? It's not yet there. So I think these resources is very important. How do we ensure that these resources, awareness, it's soft resources. It's very soft. The conscience, the mindset, mastermind. How do you ensure that we are masterminding together to fight the virus? This is the first resource. And then it can, of course, attract resources in terms of material, in terms of finance, to ensure that we have this kind of fight together. Because the pandemic will be there for a long time. It's like any other pandemic. So we have to see how we live. We have nowhere to hide. We cannot hide. So if we cannot hide, we have to face it. And how do you face it together and to fight it? So I think it's very important to ensure that this is the trends. You were talking about technology. How do we as Africa, we harness technology from the top, not from the bottom? What we are doing right is from the bottom, because we are trying to catch up with Europe, America, China, but we have to start from the top. We have to invest in resources to ensure that we have the best technology, the best communication, the best internet connections. It's very important.
Okay, Mr. Francois, I'm glad that you mentioned technology. I'm going to ask you a question. Don't you think it's time to Africa to put in place indigenous technological bases? Because we still depend on what the Chinese.
Of course, yes. We have been followers for a long time, followers, all the time. We are followers. We are from what is happening in Europe, in China, in Russia, in America. We are followers. Why do we have to be followers? We are the first continent. Africa is the first continent. Africa is the mother of the world. Why do we continue to be the followers? Why don't we ask why to be followers all the time? Why to be followers? We have all resources, human resources, the capital. We have everything. Why we don't use this to be first and to ensure that others also they can. We don't need them to be followers. Also, we have to have this kind of win-win situation. So why do we have? Because I think this is very important. When we were talking about how do we come out of this crisis, I think what we have to do is to ensure that Africa, any country in Africa, any African part, region, we have our technology, because we have, some technology are developed by our people in Europe, in America, but they don't have conducive facilities in Africa to help Africans. We have to look at this, and it requires political will. It requires our common, let's say, common will to ensure that we harness the technology, not continue buying, consuming, even the technology we are using now for communication between us. I think it's made in the US. It's not made in Africa. And it's good, but it's impossible to use this technology. You don't master your technology, you don't control it, you control nothing. Even the internet provider, who are they? Are African companies? Or so if they want to cut off this communication, they can do it. So you are not independent, but just continue to be dependent followers. So you have to ensure that we master our technology, that we own our technology, that we own our IT means, communication facilities, to ensure that we can communicate easily between ourselves without going to China or Paris or I don't know, or Madrid or New York, to ensure that we communicate with each other. I remember sometime when a long time ago, we used to go to come to Guinea Equatorial. Guinea, for example, an example I give, coming from Cameroon or coming from, let's say, Kenya, you go to London or to Madrid, flight, and come back to Guinea Equatorial. It's a waste of resources and time. So I think we have to look at this. This COVID-19 is a good opportunity for Africa, for Africans to be on our own. It's hard, very difficult, very challenging, but we have to do it. We have no choice.
But actually, Professor, we also, the Africans, I think we are part of our own problem, because I would like to have this little discussion with Professor, because most Africans, we go to the best institutions abroad. We go there, we come back with very good results, but actually we go to the universities and then we embark in careers that actually don't impact in our societies. For example, you go to the European university and learn literature. And you go and learn the European literature or American literature. How is that going to affect your community?
Thanks for the question. What we need to do, government should invest in science and technology for us to change the current setup, the way we are living. Yes, it happened before, as you said. People used to go to Europe or elsewhere, they study history and also sociology in Africa. But things are changing. We are in the fourth industrial revolution. Information technology is one of the key areas where every country in Africa should should invest and put more money at university and advise kids start from high school before they enter the university, say, this is the field we need you to study, because the more we develop science, the better the African it become. If we don't develop, if we don't invest in science and technology, Africa will still remain behind. You can see in terms of COVID vaccine, African country, we are still remain behind. So we are still waiting European country or US or China to develop vaccine and then to bring it back in Africa.
But Professor, why don't we also as Africans invest money in traditional medicine?
Yeah, traditional medicine, I saw yesterday on the news, in Senegal, they are trying to cure COVID-19 by using the African herb. That is one of the areas where we need also to invest to support traditional medicine, to be able to say, okay, this is what we have, can we apply it? And it needs a support. It needs a government support to get it. There are traditional medicine where we need have enough research, and then after that to say, okay, this we are going to implement this. But
no, but Professor, allow me to disagree a little bit with you. Do they actually need government support, or we need the European and American approval?
No, we need our government support. We don't need European or a US support on that one. You need to understand there is pharmaceutical big company in Europe who they invest a lot of money. Also, what African government should do, we need also to invest a lot of money on traditional medicine. The more we do it, the better to become. But if we don't support, and then we are not going to grow our traditional medicine. That would be my view.
Thank you very much. Mr. Esteban, I don't want to finish this blog without asking you a question. And if all the panelists allow me, I would like to ask Mr. Esteban this question in Spanish, so he can give me his answer in Spanish, and then I maybe try translate to all of you. Esteban, me gustaría saber cuál es, como le he preguntado antes, ¿qué es lo que está haciendo el Ministerio de la Función Pública para paliar los efectos del COVID-19 actualmente en el país? ¿Y cuáles son los mecanismos que utilizará después de esta pandemia? Si es que en realidad hay un después.
Gracias por entender mi situación con el inglés, que no es tan bueno. Muchas gracias. Como función pública, es decir, el aspecto que abarca todo lo que es el funcionamiento del gobierno en materia de recursos humanos, es decir, el personal que opera en esta administración. El mismo departamento adoptó desde una mañana políticas de, por ejemplo, de tomar riendas y muy en cuenta al personal mayor que estaba, o sea, que está muy propensa a infectar. Especialmente los mayores de 50 años adelante, no trabaje junto o sea, puede venir a trabajar en ocasiones muy especiales, pero guardando siempre las medidas de distanciamiento, cómo no, utilizando también los desinfectantes que están acordados. También a la hora de coger el transporte de todo el personal, también tomamos medidas de guardar también esta distancia, que no haya mucha gente dentro de los medios de transporte, porque eso también puede facilitar ciertos contagios. O sea, el transporte público también tomó esta medida de albergar solo unos cuantos, más o menos el estándar que la sanidad establece. Después de esta pandemia, también estamos tomando políticas, por ejemplo, de trabajo vía online, todavía en políticas, en proyectos para estudiar. También, por ejemplo, forum, tal como estamos aquí, utilizando vía telemática. Hay ciertos trabajos que se pueden desarrollar, inclusive estando en casa. Desde casa, apoyando al departamento en algunos asuntos, en ciertos asuntos. Todo esto lo estamos estudiando, cómo podemos implementar estas formas, estas nuevas formas de trabajar. Pero decir, sí.
Sí, continúe.
Sí, decirles que el ministerio, junto con su responsable, tiene muy en cuenta también la ampliación de los despachos. En vez de encontrar a personas, o sea, unos cuantos, o sea, dentro de un despacho, 4 o 5 funcionarios trabajando en una sola mesa, más o menos queremos tener en cuenta de que solo podrán trabajar 2, pero guardando también la distancia. Asegurar los suficientes espacios para que la persona pueda trabajar sin afectar la distancia del otro. O sea, más o menos son estrategias que estamos estudiando. Guardar el distanciamiento. Ahora se está implementando el test, la propaganda del test para todos los funcionarios, para que más o menos cada cual conozca su estado. Y todo esto son avances muy interesantes que la administración pública, junto con el Ministerio de Sanidad, están adoptando más o menos para reforzar, para concienciar y dar un sentido común a todo lo que es la situación del COVID-19.
Ok.
Ahora,
muchas gracias, Dr. Esteban. So I would just translate a little bit of what Mr. Esteban said, because I asked him the mechanism his ministry is putting in place to, during this crisis. Basically, he was just telling me, as we all know, the Ministry of Civil Service, we've been responsible of all the staffs in various ministerial departments. They are, one of the first actions they took is to send everybody above 50 years old home to work from home, because they were more in danger of contracting the virus. So they sent them home to work from home, and only come or go to their various ministry in case of extreme necessity. They also put the projects that from after the pandemic, maybe they are going to study the work online. This telework we are, and then this engage also in a lot of forums. Also, basically give information to all the staffs in various ministerial departments how to keep the 1 meter distance, wash hands, use the face masks. Basically, what the government is doing, but just to put more emphasis to it, to different ministerial department. Also engage with the Ministry of Health to test all the civil service. So basically, that's what Mr. Esteban was explaining to us. So thank you very much, my dear panelists. We'd like to move to the final question, which is the block 2, plans prepared by the public administration for the benefit of the most affected sectors to face this current situation. I would like to hear from Dr. Mari. Tell us, what are the plans you think the public administration has to draw to fight this COVID?
Okay, to fight this COVID, yeah, a lot to do, as you said, but not only the public administration, but
yeah, just give us in terms of government.
Don't worry, I'm coming to that. Yes, I'm coming to that. But let me just tell you something. For example, I don't know if you follow the news yesterday, because I have to come back on what few points and relevant points we already talk about. They are part of it. If you heard the news on TV yesterday, talking to the government in Equatorial, they said they will announce probably the initiation of phase 2 of the confinement. And but as I said before, I believe that we all have a common understanding of our individual and collective responsibility to make that workable. I know if you understand me, because allowing everyone to attend to business, because it's about that is to meet their office or their work activity or their personal activity, we have to make sure that they concretely understand that they have to be more responsible in making sure that everyone is taken care of, healthy and safe. That's what I say. What does it mean? It means that this is part of the plan, because people cannot be confined in their houses ad eternum. I mean, all the time. How the country will work, how business will work, how people even they will feed themselves, because they have to move around to work and to gain something and to do something. So they have phases according to the trend they have seen in the evolution of the disease. I think that will be communicated. That's what the message I understand from the TV said yesterday. So it means that okay, in the plan to combat this disease in the future, we have to be more responsible. We have to take into account the protective and preventive measure we are doing. We have to do it much more better, so that we can, because I cannot talk about, for example, the vaccines. You say, okay, let's take the vaccine and so on. We know how the debates are around those vaccines. So what does it mean? It means that what those measures we talk about, those key relevant measures we said was efficient, was effective, we have to continue on that. Of course, we have to, the administration was working from the beginning. From the beginning, it was difficult, for example, to decide to say, okay, let's do the telecommuting, or let's do we'll work via teleconference. But it has to be in the culture of the people also, because you have to absorb that as a citizen, to not feel yourself abandoned by the authority. I don't know if you get me. If they don't understand what the government is doing, doing the teleconferences, for example, video conferences, if the general public doesn't understand that, they will feel themselves abandoned by the authorities. So you have to balance those things. I think that's why the authority comes with that proposal. They make it progressive and as far as possible, and we continue with the thing. And then what for the next step, what I said, which is needed really to do, the public administration should continue to make the environment more conducive for all those initiatives, because what will happen is today, because we are talking about COVID-19 today, tomorrow we are talking, we were also talking about the diversification of the economy and all those things. If you want the economy works properly and according to those challenges we may face, which are related to crisis we don't control, you have to, we will need to be more concerned about creating that conducive environment. Creation and innovation are part of finding a forward-looking solution to the life we are living. If you understand the things you want, the problems you are facing daily, of course, it's only creation and innovation who will allow you to find those forward-looking solutions, anticipation. And it's related to what you were saying before. In every single sector, education, we're talking about education, we're talking about math, sciences, technology, ICTs, all those things have to be improved as far as possible. So it's a package of all those things. But one of the most important you can learn from this one is the health sector. As I said, this one has to be strengthened in terms of availability, in terms of quality of services, and quality of care for the entire population. That's key, because when it comes to, we are talking about life and death, it's about health. So we have to be very much cautious there. And it will mitigate the impact, the consequences, and if unfortunately it comes, maybe then now with the involvement of everybody, I mean, we can control much more. And then I'll finish with that part. As I said from the beginning, I was saying that what are the resources of public sector? I mean, of public administration. What are the resources? Because they don't have, I mean, they don't, it's not like a private business. I mean, you are making money. And no. This is services. So what are the resources? Resources come from when, for example, the economy is, growing properly. And for example, enterprises, businesses are paying their taxes and so forth, and et cetera, et cetera. This is what the government can, so that the public administration have that responsibility to create that conducive environment for every single business. And now, focusing on Equatorial Guinea, if you check the economy and how it's structured, of course, currently, you will say that the public administration, I mean, the public sector is the main employer, isn't it? Is the main employer currently. But it won't be in the future. In the future, it will be private initiatives. I mean, all of us innovate. The private sector in general, lato sensus, will be the main employer. So if we have that in our mind, when I say private sector, I'm talking about individual, you and I, or everybody, I mean, who can create his own business. And of course, including the others, the big ones who are around in the oil sector or in other sectors. So if you have that in mind, that makes the role of the public administration much more important, so that everything can happen nicely. If you take into account countries in Africa, you will see that in countries you have some 80% of the GPD come from informal sector. How you will make it possible if you are a government? How you will make it possible to collect, for example, taxes from those ones? They are not registered. Someone was saying in the question and answer, in the question and answer, talking about digitalization of administration, acceleration of it. Yes, we should have done that tomorrow. Many things can happen. You can create, if you have those things, you have countries where you create, for example, your own business in a few days quickly, because you don't need to move here and there. If you need some administrative document, you go to the thing, and discussion have started here. We started very well when we talk about e-governance and all those things here. So these are things to move forward, to push forward, so that that environment can be conducive. Everyone can participate in the economy according to the means you have. Thank you.
Thank you very much. I would like to go directly, because of time, I would like to go directly to ask a specific question to each of the panelists so that we can close the session. I have a question here from Consent Group for Professor Lukamba. African governments are trying to go digital. Will that ever be possible, considering the hindrances caused by corruption and procrastination in projects?
Thank you for the questions. Yeah, African governments, they are going through digitalizations. The experience we have now, which forced them to go to digitalization, is because of this COVID-19. Every government, the COVID-19 take every government by surprise to be able to work remotely. When you look government now, government meetings is being done through Zoom, through Skype. In terms of, we know the corruption is one of the area where it's disturbing most of the government. I can just give you an example of what is happening in South Africa during the COVID-19. There are over 100 companies which is being investigated by through the judiciary system because of COVID-19 funding. And corruption is not going to end today, but what needs to be done, government should put a strong mechanism into place to try to reduce corruption in a government institution. But work digitally, work remotely, this will become a new system in every sector of government currently. But when we look it forward, we need to embrace it and we need to accept it. Digitalization is going to be a mode of work everyone should do. Like currently, us at the university, we are teaching online. Currently, I'm sitting in my office here. There is no one on campus, and we are teaching online. It's something we need to accept it, and every government across Africa, we need to work digitally. But the problem now here is, how do you plan it? How do you budget it? That's what every government should be able to do. And if we do it, we will catch up with other countries the way they're doing currently.
Thank you very much. Thank you very much. Ms. Hema, I have a question for you. From Carlos Ndonsima, asks, why telecom facilities are more expensive in Equatorial Guinea than any other African country?
Thank you for the question, and that's a good one. I think from what I learned since I started working here, telecommunication is expensive here in Equatorial Guinea than any other countries around us. Firstly, because the population, most of the companies that came to start working here, they come out with a way of saying that because there is less population, they have to make profits. So, wait a minute, don't put that face. This is one of the things that I learned. So right now, the regulator, what have done is come out with a plan when he's telling each telecommunication, pardon?
Each operator.
Yes, pardon, yes. Which is telling each operator the similarities with other countries. such as Gabon, which have a similar population as Equatorial Guinea, but the telecommunication is not that high. As I said before, with the plan that we came out with, we are gradually reducing it because we talk with the operators. We came out with, we work together to see how what they have been saying is not true. So that's why right now the communication is gradually decreasing. But as I said before, it's not going to be something that, let's say today, tomorrow, is going to come out from 10 to 1.
That means, but there is a problem there. Because
yes.
Also the population are complaining that the price is reducing, also the service is getting worse.
Yes, I know. That's why right now here in the regulator, we created a department. It's a new department that they launched like about 4 months ago, just before the COVID started, is when they launched the department. They even went to the screen, the national TV, to make sure that the population know that from now on they can come out with how they say it, when they have difficulties. So let's say the internet is not working, a complaint, they can come in Hortel with a fill out paper and we can solve the problem. But before that, they have to talk with the operator. If the operator is not answering or is not doing the work the way they're supposed to do, they can come out here in the regulator and we're gonna take care of the problem. But it's something that the population doesn't know yet. As I say, we started before the COVID, and with the sickness, everything went off, you can imagine. But right now in Hortel, we have a department that is working with the operators about the quality of the service. Now we have it.
Okay, I just want to rebunk the information that the less population, the higher the price. Because if you go, for example, if you go to Estonia is probably same size as Equatorial Guinea with the same amount of population as Equatorial Guinea, and Estonia
yes.
is one of the advanced technologically country in the world.
You're right. That's what I say, that before the regulator started working, most of the companies, they had an excuse. That was the excuse for the companies. They say no because they have many excuses, and this is one of them. So that's why right now here we let them know that this is not an excuse. It's not about the population. It's what they want to say, but it's not true. So that's why here we are working with the Ministry of Telecommunication to put the things the way they're supposed to do, the way they're supposed to be, I'm sorry. So, but it's something that is gradually decreasing, like I say.
Thank you very much. Mr. Francois?
Yes.
I'm not going to ask you a question. I would just like you to give us your closing remarks for this session.
Okay, thank you very much. I think the closing word is just to thank you for the initiative for Guinea Equatorial Guinea, for the initiative. I think it's very important to continue this kind of exchange discussions. I think it's very important. The last is that I come back to what I said earlier. We have to own our economy. We have to own our development. We have to own this internet connection technology. It's very, very crucial. If we continue, of course, discussing about how they can reduce the price, but if, of course, they have to make money, they have to make profit. But we need also companies to go into this business and ensure that we have people from we need them, but they have to compete with our companies also. So to ensure that we have better service at good prices, very important. I think it's very important to think of that. Maybe we have to come back to the issue how we own our economies, how do we own our development? How do you own our education? How do we own our health system? This is the key challenge, the key issues we have to continue discussing and to ensure that they come out of this crisis with actions, with outcomes, with good trends for Africa, for our country, for our populations. Thank you.
Thank you very much. Professor Lukamba, your closing remarks, please.
Thank you. What I'd like to say, public administration in Africa should be able to provide service. What I mean by service, a good quality of service in all the sector of health sector, especially if you look the quality of hospital we do have in Africa, sometimes it's very problematic. And the government need to provide enough funding in the government for the quality of service to become more acceptable. And if we do it, public administration or government institution in Africa will change for the future, for the better. That's what I'd like to say.
Thank you very much. Dr. Mahdi, closing remarks, please.
First, I thank you again, the organizers. And I think this is a very good initiative, and please keep it up. And to win more relevant issues for the government, because it's about that, how we can come with actionable recommendations so that it can help everyone in the country or as a development partner. Having said that, I would also say that the administration is key. I mean, talking about good governance and all those things, we'll talk about corruption and so forth. So it's key. The role of the administration is key. So, and fortunately, in Equatorial Guinea, if you see how administration work and in African country, in the conditions their work, if you see that, you will say first, the foundation is already there here in Equatorial Guinea, because it all is start. You need to have the infrastructure to be able to do those things. People have to be able to move here and there as they want, because you have that infrastructure. You have roads, you have, and they have to, the working environment where they are sitting, working. Here I'm in my office, I'm certified in the office, because I have seen officers elsewhere in other countries. So in terms of infrastructure, the foundation is there already. Roads, transport, because you have planes here. I mean, because we are in COVID situation, that's the reason why. But people can move around. You have roads, you can go from one part of the country in another, you have nice roads and so forth. So that is there. The next step, I mean, because it's prioritization. I think it's a good way of doing that. I know why I'm saying that, because you go to in every single African country, you will see that, say that, okay, this is the right way to do that. But now we have to invest on the people, the human capital, quality human capital. Quality human capital comes with all those problems solved. Corruption will be solved, because if you are, for example, a civil servant, you know that your role here is to provide quality and services to the population. You will be able to do so. So it's part of the human capital. So that need tremendous work. We have to work on that, and we talk about also the orientation, the fields. If you have to, we need to project ourselves in the future. What are the new areas we want to see so that the country can develop? For example, in terms, you were talking about why we are following the technology of here and there, but are we investing on that in terms of education. So you have universities. Universities. I'm coming from. I have a background of. I was in the university. I'm coming from there. So things don't change there. You cannot do revolution there easily, because we used to do same things, and so those things have to change, because you have to look at the way the world is going. You have to project yourself, like in our Africa Union agenda, for example, in 2063, what you would like to see in the countries. If you project yourself, you may need to do a lot of change in the universities in terms of training, in what are the key areas where the focus will be, and so forth, so that the people who will come from those institutions are well prepared to serve the country toward that objective, that goal, the Africa we want to see in 2063, for example. If we don't anticipate, we do our daily things, we deal with to find solution in our only thing, which are not forward-looking solutions, we won't be able to move forward. So that's the role of the public administration, to regulate, to create that conducive environment. I'm insisting on that. That's the role. Of course, to be able to do that, of course, those ICTs is important, we have to do. So Equatorial Guinea even can play a key role in the region. As I said, the foundation is there. Why not be like kind of hub for the Central Africa? It can be a hub in many things. So it's just to think deeply on that and to see how to move in that direction. Thank you.
Thank you very much. Ms. Hema, a closing remark, please.
Yes, thank you for giving me this opportunity. Since Mr. Lukamba and Mr. Mahdi are talking about improving the African Union, as I can say, improving the African Union to come out with solutions. There is something that we have to have in mind. It's a reality here in Africa. We are trying to do Africa, we are trying to work together as one, but Africa yet is not one. Maybe because of the colonizations. But we have to understand that many countries in Africa, they don't take decisions on their own. They have to ask the outside world. Like Mr. Lukamba said, we have to improve in science, we have to improve in technology here in Africa. But most of the countries, I'm gonna say not most, but many, hopefully not most, many countries in Africa, before they improve in these aspects, they have to ask the outside countries, because they don't take decisions on their own. It's something that we have to have in mind. But I hope in the future, this can change. We can become one. We can work with the projects that we want to we want to push, we want to develop with any without difficulties from the outsiders. That would be all. Thank you.
Thank you very much. Señor Esteban, sus conclusiones finales para esta sesión, por favor.
Gracias. Buenas tardes. Y creo que me uno a las diferentes cuestiones que han presentado los panelistas, de que juntos somos fuertes, pero esta unidad no solo debe basarse en intereses económicos. Yo pienso que con la moral alta, como africanos que somos, priorizando desde nuestra base, desde lo que ya somos, de lo que ya tenemos, hacerlo fuerte, es decir, potenciar las estructuras que tenemos ya como africanos. Podemos aprovechar este potencial, trabajar muy de base con lo que ya tenemos, hacerlo grande, enriquecer nuestra cultura como primer paso. Entonces, cuando nuestra cultura está bien sólida, podemos adaptar cualquiera que venga, siempre y cuando que nos aventaja, siempre y cuando que esta cultura nueva va a reforzar la base que ya tenemos. Como africanos tenemos que tener una buena base, o sea, nuestra base cultural debe ser primordial, un aspecto primordial. Y entonces, ahí podemos incluir todo lo que realmente ayuda al crecimiento, ya sea social, educativo, cultural, todos los soportes, apoyos que traen los demás países, ya sean occidentales, inclusive asiáticos. Esta es la conclusión.
Thank you very much, Mr. Esteban was just trying was saying that Africa needs to be united, but this unity does not need to focus only on the economic aspect, but also the moral aspect of it, so that Africa will have a solid foundation as Africans, so that in case of any other external influence, we mean that Africa has a solid background, and with that background, we need to work towards a unique direction to improve the life of Africans and the unity of our continent. Basically, that's what Mr. Esteban was trying to tell to us. So I want to thank each and all of you, my panelists, our Mr. Francois. Thank you very much for taking part in this session.
Muchísimas gracias.
Mr. Madi, thank you very much for participating.
You're most welcome. Thank you very much for organizing this.
Professor,
thank you very much for the invitation, and then I'm looking forward one day again we'll talk again.
Ms. Sema, thank you very much.
Thank you very much as well. Thank you.
And Mr. Esteban, thank you very much for joining us today. I would like to end our session here with giving thanks to the Ministry of Civil Service of Equatorial Guinea, IQ Farm and IQ Farm Foundation, and Clarence Abogados for putting, and the African HI Forum for putting on this wonderful session. And this session is the ending of our monthly webinar for the month of July. And I want to thank each and every one of you again for participating. I thank you all, the viewers at home and the organizers, and for giving me this opportunity to moderate this session. My name is Alejandro Evuna. I'm the Secretary at the Embassy of Equatorial Guinea in Cairo. Thank you very much and good evening.
Thank you. Bye.
Thank you and bye.
Thank you.
Ciao, ciao. Ciao.